Hi there. I wanted to talk about these unique class of drugs called biologics. You may have heard about biologics in the context of rheumatology. These drugs are also used in other fields of medicine like gastroenterology, oncology, dermatology, etc. Um, so, biologics are a class of drugs that really work by suppressing your immune system. They work on certain targets or cytokines or molecules that work in the immune system, and by decreasing the activity or inhibiting those molecules, they are able to decrease the inflammation in your body. And as a result, this helps control the autoimmune condition that we are trying to treat. Biologics are usually of different categories. For example, the TNF inhibitors, you may have heard about Enbrel, Humira, Simponi Aria, Remicade, Cimzia, etc. Then, of course, there are the IL-6 inhibitors like Actemra, Kevzara, the T-cell inhibitors like Orencia. Then we have the B-cell inhibitors like rituximab, Benlysta. We have an interferon inhibitor like Safnello. We have some IL-17 inhibitors like Taltz, Cosentyx. The IL-12/23 inhibitors like Stelara, IL-23 inhibitors like Tremfya. We have the JAK inhibitors, or which are small molecule inhibitors, which are Xeljanz, Olumiant, and Rinvoq, and the list goes on. Whenever you're on a biologic, remember your immune system does get suppressed, so you have to be careful about infections. Make sure you are vaccinated appropriately. Try to be careful around people, avoid crowds, large gatherings. If you get sick, you might want to consider getting treated and take an antibiotic if necessary. Some of these biologics come with other warnings like a risk of cancer, risk of blood clots, etc. Make sure to discuss with your rheumatologist. Depending on what kind of biologic you are considering, the risks are different. Biologics can be administered in various ways. They can be oral, like the JAK inhibitors. They can be self-administered or self-injectables, like the Enbrel, Humira, Orencia, etc. And they can be given IV or through the vein, called infusions, like Remicade, Simponi Aria, Actemra, Orencia, rituximab, etc. Um, Again, overall, these are great drugs but have to be used and monitored by your rheumatologist. This is Dr. Nilanjana Bose from Lone Star Rheumatology. Thank you.